of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in North Oaks, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
I'm Dr. Richard Jensen.
And as it said there, natural flu and cold vaccine, could that be possible? Is it, wherever you are right now, is it the cold and flu season? The program goes all over the world, so we have different times and different seasons. And so we're going to look at what you can do to have strong immunity against flu and colds and these upper respiratory infections. And my esteemed colleague, Dr. Richard Jensen, is going to lead us in that down. Dr. Jensen, please.
Thank you, Dr. Lala. Well, history repeats itself. It really does. By the time the flu vaccine is released, it is out of date and largely ineffective. The thing with this is basically the flu is generally created within birds, actually, and there's a certain amount of genetic drift each year. And so what they do is they try to take, they look at the flu that was around last year, and they use that as components for the new vaccine to be created for this year's version, and hoping that drift is not enough so that it is effective against it. But the problem is what they're looking for is in case there's an epidemic, and that epidemic means that there's going to be a dramatic jump in that shift, so that's going to be a completely new vaccine. Well, if the old vaccine is based upon the old product, then the new one, when it becomes an epidemic, is going to be way out of date. And they've been looking for that. That generally occurs every about 20 years. And we've been overdue for this for about another 20 years. So that's why they keep looking at it, and becomes a stronger probability from then. So that what we're looking at now is an example of it being largely ineffective. And that example is the swine flu shots. In the 1970s, it was a swine flu, but every medical doctor surveyed said they would not administer the swine flu shot to their own children. Interesting, so many people got sick from the swine flu shot that $1.3 billion in claims were filed due to injury and death. Now, this is back in the 1970s that it was $1.3 billion. 517 Americans who took the swine flu shots ended up with Guillain-Barré syndrome. This is a disease that causes severe weakness, pain, and paralysis. And in 2004, it was not having enough, 2004 season, we found it was not having enough flu vaccine to inoculate everyone. So that they were just looking at particular individuals who were high risk, which is generally the very old and the very young, whose immune systems may not be enough to handle it. So since it's designed to treat the previous year's viral strain, but every year the virus mutates and develops additional strains, making it effective against new strains, is very hard. This transgenic mutations resist the year's current vaccine. So then, we find that the vaccine in many cases causes the flu. In a recent Dutch study, 49% of seniors who received the flu vaccine developed the severe flu. Meanwhile, 48% of the non-vaccinated population got the flu, while 50% of those who were vaccinated got the flu. Okay? So we're looking at 49% of the seniors who received the flu vaccine developed severe flu. 50% of the general population who were vaccinated got the flu. 48% of the non-vaccinated population got the flu. So does it matter? All those numbers are pretty much the same. So what we're looking at is they're saying that this is a worthless thing. And this isn't just me telling you, this is something that we have the quote. There is no evidence that any influenza vaccine thus far developed is effective in preventing or mitigating any attack of influenza. The producers of these vaccines know that they are worthless, but they go on selling them. And this quote comes from J. Anthony Morris, Chief Vaccine Control Office of the FDA. So what we find is that in the drug business, you make money by promoting and selling and using whatever means available to frighten and scare people in order for them to take that product. It's good marketing, I guess. So is the flu vaccine safe? Well, to go into that, we'll have Dr. Lala comment.
Well, that's up to you. Certainly we don't want people getting sick, but it contains formaldehyde, thimerosal, which is a mercury compound. Knowing that mercury, of course, is a toxic metal, and formaldehyde and thimerosal are toxic substances, doesn't make sense to put the chemicals into your body. Only you can answer that question, not me. Now, flu shots and Alzheimer's disease. We have another quote here from Hugh Frudenberg, one of the world's leading immunogenicists, states that a person who receives yearly flu shots increases their likelihood of developing Alzheimer's disease. That's interesting. How about, are there any potential adverse effects of flu vaccines? Yes, there are. Anaphylactic shock, pericarditis, or inflammation of the pericardium, that's the sac that the heart rests in. Nephritis, that's kidney infection. Guillain-Barré syndrome, you don't want that, I'll tell you. And of course, Alzheimer's disease. Now, how about boosting your immune system naturally? A lot of people, because what they do is they take that vaccine and they inject it into eggs, and then the egg grows, and then they develop that. And so that's protein. And people who have protein allergies are going to have reactions, or they're going to be a much higher propensity of reaction to the flu shot, okay? And they generally tell you that in the medical clinics when you go to get those shots. So boosting your immune system naturally. Dr. Jensen?
Thank you, Dr. Lala. Well, things that we can use to support our immune system is one, vitamin C. Vitamin C supports the integrity of the immune system. It also, we find that when people get depleted, they're under a lot of stress from the immune function, that it depletes the adrenal glands and the adrenal corticosteroids. And so what happens is the immune system, vitamin C is in its highest concentration within the adrenal glands. So it's used for the creation of that and the creation of norepinephrine. It also helps in the creation of the connective tissue in the body, and therefore helps the connectivity between cells. And many people will talk about that as not allowing the virus to get in as far. Let's look at zinc. Zinc also supports the immune system and has some wonderful effects in that regard. How about homeopathic remedies? Homeopathic remedies including echinacea, lemon balm, slippery elm bark, or fritillary bulb. Those can be very effective solutions to that. Did you have a comment?
So we found that these different HPs for flu, upper respiratory, non-infections, non-productive, and productive upper respiratory infections, that those homeopathic remedies are often quite effective.
Very effective.
And they're natural, and they don't have any adverse effects on anyone.
In fact, they don't. The reason why they don't have adverse effects is because many times they are almost a biofeedback mechanism into the body. So it's a signal telling the body to react to these things, such as if you have, say, nausea. The homeopathic basically uses a substance that causes nausea to help fight nausea, but it's prepared in such a way that there's basically only the electronic signature of that substance left within the homeopathic remedy, so that the body recognizes it and says, hey, nausea is coming, let's combat that, and the nausea goes away.
Whereas in the flu shot, or the virus is still in there, it's been attenuated or weakened.
Right.
But it's still, you're putting another virus into that human body.
Sure, and it's making it so that the immune system has to work against it.
Okay, as a doctor of chiropractic, what about chiropractic care? Have you found in your experience that it's valuable to assist the body in preventing or?
Certainly, chiropractic spinal care is very important for that, and we will find that up in the next couple of slides that we have. Other ways of also helping this is with acupuncture. It can help boost your immune system naturally. Going back to chiropractic spinal care, what we have is that they find that there is a link between the central nervous system and the immune system. And so that nervous impingement or say what we talk about is in subluxations, which is basically putting stress on a nerve, mechanical stress on a nerve, can cause stress in the nervous system, which goes to a part of the brain called the hypothalamus, which then the hypothalamus produces a fight or flight response or a restorative response. And that restorative response, or the fight or flight response, actually lowers the effectiveness of our immune system. The link between the CNS and the immune system supports chiropractic notion that nerve impingement stress on the body at the site of subluxation, as well as throughout the body or systemically. And these findings are found from the Journal of Manipulative Physiology and Therapy in 1989. So it's not just us making claims, it's the research is out there. Chiropractic spinal care also, there was a study performed at the Anglo-European College of Chiropractic in the year 2000 that demonstrated that chiropractic adjustments lead to the increase of serum IgM, this is your immune system, levels. Now, serum IgM is an indicator of immune function. So what they found is that chiropractic adjustments, it had been demonstrated that it actually shows an increase of immune system function in the body, which is what you want to do, is to encourage that immune system in times of the flu. Now, let's go into the chiropractic adjustment. What we're finding here is that with the impingement, as we look here on the right-hand side of the screen, this is a normal spinal column. And the spinal column is in alignment. You see the bones are right on top of each other. There's no pinching of the disc in here. If there's a disc space in here, there's no pinching of that. And what we find is these holes back here, they're called the intervertebral foramina. Those allow the nerves, the arteries, the veins, lymphatic tissue, and meridians to flow through those freely, okay? And where they flow freely, you have free exchange of that information that allows the body to perform optimally. Now, if you come over here, you have not a dislocated bone, but a malpositioned bone. And this malposition can be caused by a number of different factors in the body. But what we have down here is we see where this space here for the intervertebral disc, that has been compromised, causing a wedge down here. Also, its posterior motion creates a small or smaller hole. It constricts that hole, and therefore, if you see above here or even down here, this is a normal intervertebral foramina. This is an encroached vertebral foramina, and so with the lack of space, there's pressure being placed upon those structures of nerve, artery, vein, lymphatics, and meridians. In fact, what we find is that first encroaches upon, it affects the vasculature, which goes a number of levels above and a number of levels below of that particular structure. So as we look at a subluxation further, we can see in this next spine, these are two vertebrae that are in good alignment. Good alignment, this is normal. What we see is from the back side of the spine, we have two joints here. These are actually normal joints that they have a joint capsule around them. The capsule is not depicted here. This is a model of the bone and the nerves. Here's the nerve that comes out from the spinal cord, which is this yellow portion that comes through the spinal canal in the back. Here's another nerve coming off on this side. This is what's going through those intervertebral foramina, which is right in front of where the arrow is here. It's not depicted here. It's if you were looking at it from the side, that's where those nerves come out. Now, like I said, it's not a subluxation is not a dislocation of the bone, but it is a malposition, such as this here. Now, normal movement can take place in there, but what you don't see in here is a lot of times there's a little impingement, swelling that's taking place in here that's keeping this space in here and constricting this space in here, which can cause an irritation. When it comes down like that, it makes the hole over on this side where the nerve travels out smaller, putting pressure on that nerve. And what they find in research is that pressure on a nerve, such as the same amount as having, say, a quarter balanced in your hand, is enough to change that nerve function, so that by closing that hole and putting more pressure on that nerve is actually deleterious to that nerve's function, and wherever that nerve is going to not be functioning at optimum levels. Also, that is a site where it creates stress, where we talked earlier, where the brain interprets it as stress, releases those corticosteroids, and what that does is lowers the immune system's response. So that, as we go back to that slide, we can see the differences here in what a subluxation is from normal. And that's what a chiropractor does, is places this back into this. Now, one of the things that we can find is the longer that's in that, we can actually have muscles move bone, and we can actually have muscles that go between these two areas here, that go between here and here, that they can actually spasm due to that pain, trying to shore up that area so it doesn't cause any more pain, and actually holds this into this position or into a subluxated position, and it becomes a vicious cycle that needs to be disturbed in order to bring it back into correct alignment and function. So then, for chiropractic spinal care, a single chiropractic adjustment has been found to enhance immune cells and increase substance P, which is a chemical which may prime those immune cells for a reactive burst. And those were from the proceedings of International Conference on Spinal Manipulation in 1990. So then further reflection on chiropractic spinal care for Dr. Lala.
This is an excellent quote. History shows that under chiropractic care during the Great Flu pandemic of 1918 had far fewer chances of survival. So the chance was better. They survived better when they were receiving chiropractic care as opposed to those who did not. And I quote that from the San Francisco Chronicle, January 27th of 2004. That's some pretty good research there. And then the Palmer College of Chiropractic published the ratios of patients succumbing to the flu as 1.886 for chiropractic care. Other systems, which were the typical...
That's a ratio of 1 out of 886.
1 out of, thank you very much. 1 out of 886 for chiropractic care. Other systems of care at that time had ratios of 1 out of 17 and 1 out of 32. And that again is from the San Francisco Chronicle, January 27th, 2004, so that's not all that long ago. Now, what about acupuncture? Dr. Jensen, you're board certified in acupuncture and have studied both the Eastern and Western approach to acupuncture, and I hope that you discuss the differences too between those two. So what about acupuncture and colds and flus and immunity?
Sure. In acupuncture, colds are a reaction to extremes, where the body is attempting to bring itself into balance with seasonal change, stress, and often excesses that we've been going through in life. Many times through the seasonal change, the kids are just going back to school, or maybe it's Christmas. There's a lot of emotional changes in there. The weather is changing. It's getting colder outside or getting warmer outside. Do we wear a jacket or don't we wear a jacket? It's us trying to normalize our environment or being able to survive in a changing environment. And so the body is under stress. And so we find that the body is in a cool stage and the resistance is low in this when it's under stress. It's in a cool stage. And so it lowers its resistance. Well, what happens then is when it's cool, the body responds with heat, and therefore we have fever. So this is a way in which Eastern medicine describes this process, is that the body is cold and its response to being cold, hey, let's raise the body temperature and therefore a fever. However, then it comes down to that the body, in reaction to the heat, releases cold, and therefore you have chills. That's a way of describing it. In Western science, it looks as though for the body to more effectively go through its chemical reactions and changes that it needs to do to help it fight off the infections better, it raises the body temperature, which allows those chemical reactions for the immune cells and all of that to do its job easier as well as inhibit the infection by raising the body temperature too high for it, we tend to have a fever. Now, when we have a fever, our body is hotter than the environment then seems cold, and we go into chills. So it's a back and forth reaction. What acupuncture then does is it helps normalize these things, helps us go through these different symptoms at a much faster rate. So we're looking that acupuncture serves to restore balance to the body between heat and cold, thus restoring its resistance. Now, there are differences in practitioners of this. And as you look at the illustrations here, a lot of times acupuncture diagnosis can come through looking at the tongue, taking pulses, seeing how they react, as well as looking at different palpation spots on the body, because they will be tender depending on how far out that is. And then there's a difference here. Many practitioners in practice, they have a cookbook acupuncture base rather than a diagnostic-based acupuncture. And cookbook can be very, very good. You know, you look at the symptoms and say, oh, you have a cold? Well, this treatment helps for that. And many times cookbook treatments, in order to take care of all the different symptoms that are there, will put in a number of needles all over to take care of all these instances at once. However, that's not individually based. When we find that when we go into a diagnostic-based acupuncture, it allows for, it's not a confusion of signals that you're giving that person through the stimulation, but more of a harmonious set of signals, and therefore it balances is much better, and we find that it is a much more effective way of treating when we go and we diagnose the patient each time, putting into what is the most effective acupuncture treatment at that time for the individual, because it's always a snapshot each time they come in, because they're going to have changed from the last time that you see them.
I know many of the people that talk to me that have, and they'll say they've had acupuncture,
Mm-hmm.
and I'll say, well, did you have an examination? I mean, a physical examination, I'll say, well, an exam that they did an acupuncture exam on you. Well, not really. I just told them that I had migraine headaches or back problems or irritable bowel syndrome or dysmenorrhea or candidiasis, you know, some fibromyalgia.
Mm-hmm.
And I'll say, well, so you went in there how many times? Oh, 3 or 4 times, 5 or 6 times. And I'll say, well, did they do an evaluation on you on each visit? No, I just went in and took off my clothes and laid down, and they popped the needles in me.
Mm-hmm.
And I'll say, oh, okay, and how long did it last? Oh, 15 minutes. And I'll say, oh, well, I see you practice acupuncture every day of the week, you know, and I see that you do an extensive examination on the patient first to really find out where they're at, and that you also look at some of their conditions from a biochemical perspective through blood studies. And I don't see any of your patients walk in there and walk out in 10 or 15 minutes, or even 20 minutes for that matter. So I wonder if it's kind of like a high volume practice where you kind of hang the patient on a hook like a piece of cattle and you just run them through, you know, and run them through. And what's sad about that is not only does it increase the propensity of misdiagnosis, but also mistreatment. And then the patient says, well, I had acupuncture, it didn't work. And I have yet to meet, I've seen people who went in for drug addiction and alcoholism and for addiction to tobacco products who had little to no examination and got no results from the acupuncture treatment, as opposed to those who said, well, the chiropractor did examine me and did evaluate me on visits, and my addiction left. I haven't had it back since. So it says that, again, we can do things so quick to people that we maldiagnose them or we fail to diagnose them,
Right.
and then the treatment is not appropriate to that individual system, right?
Right, right. And it really comes down to when they come in, each time I ask them questions as to what's going on, what's their energy level, when is things changing. A lot of times you can tell that there's disturbance in their sleep patterns, when that's taking place, because the body is reacting at different times. There's many times when people will say, yeah, I wake up at night. Well, what time are you waking up at night? And, it's their pulses and their tongue will indicate a certain time of night. There's some people, like the disturbance will be, say, in their liver and in their lung. Well, liver is usually, people will wake up at night between 1 and 3, and the lung will be between 3 and 5 in the morning. And they'll say, well, I'm waking up at 3, which is actually in both spots are in there. It's just the transition area. And you look at them and they have the symptoms for both. Many times people will come in with symptoms that are both hot and cold, and so you have to take that into effect.
What about the tongue? You mentioned the tongue.
The tongue has many different aspects to it. When you're looking at the tongue, it's how it reads many different things about the body. It's how the blood is being transported to the tongue, and how the tongue can be swollen, or where it's swollen, how it has cracks in the tongue, and where that changes the symptoms and what things are being involved, whether certain taste buds are inflamed or not. And its position on the tongue can make differences in diagnosis.
I know that we make digital pictures of not only our patient's posture and their x-rays, so they can put all of that on a disc for their medical records. But I know that we make digital pictures of their tongue.
Right.
And that's a beautiful close-up picture, and it is unbelievable when people really see what their tongue looks like, and then you begin to explain what these different crevices mean and where there are papillae that are swollen and things like that. So and you can literally look at that tongue and often say, well, I can tell you what's wrong with you.
There's many times, say, when you ask me into your office, and I'll take a look at the tongue and I'll go through, oh, you have this, and this. And the patient's eyebrows will go up, and yours will go up too, saying, he knows nothing about your history at this point. And that will just hit the nail right on the head, which is great proof to me, being raised in a Western society, to see that this Eastern society stuff really does correlate well with it.
There's nothing occultish about it as long as it's used not from an occult perspective, but from a Christian perspective, okay, used with the right intent. If I do something that's self-serving, then I consider that to be the occult. But if I do that as a service, putting the patient, putting you before, then it certainly is a godly thing. And it's the same thing. We can take a look at a set of films, and we have a lot of x-rays come into our clinic that have been made in hospitals and other chiropractic clinics. And without even seeing the patient, by looking at the type of problems in the spine that we see, and we can look at where we see a subluxation or a bone out of place and say, my gosh, we know that there has to be some form of nerve and blood and lymphatic and acupuncture meridian interference there, and pretty well guess what kind of symptoms that person has, or that they're probably, or in all probability, going to have. So again, we're destroyed for a lack of knowledge. There are a lot of good things that you can do out there naturally to help yourself. There are a lot of good homeopathic products out there, but make sure you're buying them from a pharmaceutical grade. Make sure that they are good products, not that just somebody says they're good, or that the person in the health food store has got this wonderful personality, but that there is scientific evidence to substantiate their quality.
The Fellowship of the Great Physicians through the School of Health and Healing provides classes each Thursday evening. The primary focus of these classes is biblically based spiritual health and healing, with a brief teaching on physical health and wellness. There is no charge or registration fee for these classes, but a free will offering is received. For further information on the School of Health and Healing, class time and location, or the topics discussed on today's program, contact us at the Fellowship of the Great Physicians, care of Dr. Lala or Dr. Jason, at 200 Village Center Drive, Suite 100, North Oaks, Minnesota, 55127, or telephone us at 651-484-5500.